dancers from the music department of Kenyatta University. An applause for Rambolo dancers. Thank you very much. Rambolo dancers, thank you very much. This was arranged, Your Excellency, by our own entertainment coordinator, Dr. Oyugi. Your Excellency, Madam, it's now my pleasure to invite the Dean, School of Public Health and Applied Human Sciences, Professor Margaret Keraka. Professor will make welcoming remarks and invite the Head Directorate of Preventive and Promotion Health to make the remarks. Let's appreciate Professor Keraka as she takes on stage. Thank you.
Thank you very much. The First Lady, Excellence, Margaret Kenyatta, the Chief Administrative Secretary, Dr. Mercy Mwangangi, the Chairman of the University Council, Professor Shem Migoti Adola, the Vice Chancellor, Professor Paul K. Wainaina, UNICEF Country Representative, Kenya Country Office, Dr. Manisa Samani, the Head Division of Health Promotion, representing the Head Promotive Health at the Ministry of Health, Madam Gladys Mogambi, the University Management, the Deans of Schools and Chairman of Departments, ladies and gentlemen, welcome to Kenyatta University. Your Excellency, the First Lady, the School of Public Health and Applied Human Sciences is delighted to host this conference on health promotion at this university under the theme Promoting Health During and Beyond COVID-19. The school is known for its excellence in research and training of public health professionals who play a key role in disease prevention and control. A major role in training of public health professionals is inculcation of knowledge and application of public health education to the community. It is known that the more knowledgeable the community is, the less the preference of preventable diseases. This conference on health promotion comes at a time when COVID-19 has had devastating effects on the humans. The health promotion has been seen to play a key role in prevention and management of COVID-19. Even if our strength to fight pandemics has been tested, we recognize that it is through effective communication and messaging that we have been able to significantly make gains in the management of this pandemic. It is for this reason that we need more people on the ground to strengthen health promotion and research. We request the Ministry of Health to open up more opportunities to absorb the public health professionals to take up the preventive and promotive roles in responding to the emerging and re-emerging diseases and avoid future pandemics. Your Excellency, the objectives of the conference include to create synergies for improved partnership, planning and implementation of programs aimed at preventing COVID-19 and related infections. It also aims to promote sharing and implementation of best practices, also to identify strategies that can be leveraged to increase access to quality and responsive COVID-19 services, in addition to facilitate future action plans for improving access to preventive and management of COVID-19 related care, and finally to empower the community to take control of their own health. The conference objectives will be achieved through deliberations on the following thematic areas: COVID-19 and related health promotion issues, healthcare systems and advocacy in health, policy framework in health promotion, control and management of diseases, healthier lifestyles, and behavior change. I want to acknowledge our collaborators, the Ministry of Health and its partners, for the financial support to organize this conference. The conference is scheduled for 3 days, during which the following outcomes are expected. We expect to identify gaps in current health promotion interventions, in accelerating progress on achievement of the SDGs. Also, we expect to identify gaps in the role of health promotion in responding to public health emergencies, preparedness, and response. We also expect to document the role of health promotion in responding to pandemics, such as COVID-19, and also to develop health promotion action for prevention and management of COVID-19 and other related pandemics. With those few remarks, I wish you fruitful deliberations during this conference, dissemination of knowledge, skills, and values that will be generated. Thank you.
Thank you, Dean. Let us appreciate the Dean once more. Your Excellency, it's now my pleasure to invite Ms. Gladys Mugambi from the Ministry of Health. Ms. Mugambi will be representing Dr. Andrew Mulwa, the Head Directorate of Preventive and Promotive Health. Let's appreciate Madam as she takes on stage. Thank you.
Your Excellency, the First Lady, the Vice Chancellor of the University, the Chairman, the country representative, UNICEF, all protocols observed. Good morning, everyone. I'm here to represent Dr. Mulwa, who is not able to come. And as the head of the Division of Health Promotion, this is an exciting moment for us to come together with the researchers to get information that is going to help us as we develop policies and come up with programs that are going to promote health. Let me start by thanking the First Lady for championing for health promotion through the Beyond Zero, because what you've been doing is actually promoting health, mobilizing people for action, and being able to show that at whatever age we should continue with exercise. That is health promotion. You've been promoting nutrition. You are our champion in scaling up nutrition, which we appreciate. So we are here with officers from all over the country. All counties are represented by health promotion officers. I know they are somewhere. You can raise your hands because we must confirm that. Because when the whole country is here, then action will take place on the ground. We've been having health promotion for years. It is the core of the Ministry of Health. It was the beginning of the ministry. Actually, even where we sit is where the Ministry of Health started. But for anything to take place, there is a journey. And the journey has not been very smooth. We used to have times when health promoters used to come to our homes and they will teach us how to feed our children. They will tell us how to take care of our compound. But here we are with COVID, and we are starting to think of how to make sure people are washing hands. Simple things that would have been done and would have been part of us. So we are here because the theme is about promoting health now and beyond COVID-19. It means we are going to agree on how to move forward so that we can change our country from being a country where we are dealing with disease to being a country where we are promoting good health. So we are here also to mobilize resources. We have our partners who have been working with us. Several partners have come to support the ministry, and in various programs we are getting support that helps us to implement programs on the ground. We are dealing with diseases that are communicable. We are also dealing with non-communicable diseases. So when we come together and see how to deal with them, it will be very useful to us. We are developing a policy, and we're hoping that this policy will be informed by what we gather through this conference. So we've been working together with the university to organize this, and we are very grateful that everyone came. And this is a time for me to say welcome everyone, and let us have discussions that are going to be fruitful, and let's enjoy ourselves. The dancing we are seeing here is part of promotion, so if there's a time to dance, dance. Thank you very much.
Thank you very much, Daktari. Apologies for missing out on the title. That was Dr. Gladys Mugambi. Your Excellency, it's now my pleasure to invite Dr. Asha Mohammed, the Secretary General, Kenya Red Cross Society, to make some remarks. As she comes on stage, I would like to let you know that these proceedings are being covered live on KUTV, and other social media platforms. After the remarks by Madam Asha, I will then request June Ogola, my co-MC, to take the program on from there. Thank you very much. Let's appreciate Daktari as she makes her remarks. Thank you.
Your Excellency, the First Lady of the Republic of Kenya, Mrs. Margaret Kenyatta, the Chief Administrative Secretary, Dr. Mercy Mwangangi, the Director, UNICEF Country Representative, Dr. Maniza Zaman, the University Management, ladies and gentlemen, distinguished guests, all protocol observed, good morning. The negative impact of COVID-19 pandemic on people's health and livelihoods cannot be overstated. The pandemic has tested our resilience at a time when most of our communities are already stressed by climate change, economic slowdown, and in particular today, drought, which has left nearly 3.5 million people across the country food insecure. COVID-19 has also tested our health systems and our ability to deliver on our universal health aspirations. Most impacted are the vulnerable communities, especially in our rural areas and informal settlements in the urban centers. COVID-19 has been a wake-up call. Health promotion has been a driver for public health over the years and is critical in our work with vulnerable communities. I'm pleased that the measures that we have all instituted, both for infection prevention and control and vaccination, are working. We need to sustain our actions since we are not yet out of the woods. From the recent statistics on COVID-19 cases and fatality rate in Kenya, it is clear that vaccination is the solution for the society to get back to normal, in quotes, and for restrictions to be permanently eased. The vaccines are only one of the many tools we have to prevent infections and save lives. However, the right strategy is a comprehensive approach which will focus on addressing a number of issues. From the onset, Kenya Red Cross has been in the forefront supporting the Ministry of Health efforts to contain the spread of COVID-19 countrywide. We are currently supporting the rollout of vaccination in 35 counties, and with the support of Africa CDC, are also supporting 12 Red Cross Red Crescent societies in East Africa, the Horn of Africa, and Indian Ocean Islands. Kenya Red Cross has a robust community engagement component focused on addressing vaccine mistrust and misinformation, including vaccine demand and response to questions and prioritization criteria of the vaccine delivery. The organization is utilizing a combination of interventions, which include mass and social media campaigns, as well as training of 2,217 healthcare professionals, 476 media personnel, 988 community and religious leaders, 2,010 community health volunteers on risk communication and community engagement, as well as vaccine management. In 2020, we partnered with the Ministry of Health in the training of more than 70,000 community health volunteers across the country. While efforts to vaccinate our population have picked up, factors such as the drought in parts of the country and food insecurity, conflict, continue to impact vaccine uptake negatively. We continue to implement an integrated approach that allows us to respond to these emergencies while conducting vaccination drives. The Kenya Red Cross believes that understanding community perceptions is key to successful vaccination drives. For example, through the support of ECHO, we recently conducted a perception survey in collaboration with the Ministry of Health in 9 counties of Lamu, Turkana, Kitui, Samburu, Isiolo, Wajir, Mandera, Garissa, and Marsabit, where vaccine uptake is still low. The findings from this survey are now informing risk communication messaging by both the Ministry of Health and the Kenya Red Cross. And some of the findings from this survey include that there is good knowledge by the community on how and where to report adverse events after receiving vaccination. The knowledge on where to receive the vaccine is high in the community, and most preferred place is the government health facilities. The concern about getting COVID-19 and the worries in relation to COVID-19, however, have reduced among the community members, hence affecting vaccine uptake. This has majorly been contributed by the directive issued on use of masks, where 41% of the respondents indicated the directive is an indication that there is no COVID-19, which is false. The precautionary measures put in place by the government are regarded as important but difficult to keep. The community has not fully trusted the COVID-19 vaccine, its safety and importance. There are still information gaps on vaccine use by expectant and lactating mothers, where 30.4% respondents needed more clarification to help them make an informed decision about whether to get vaccinated against COVID-19. Some of the key recommendations from the survey include continuous engagement of influential community and religious leaders in risk communication and community engagement to improve vaccine uptake, creating demand and employing a mix of vaccine delivery mechanisms to target and reach key priority groups is an effective way to improve vaccine uptake and achieve greater equity in coverage. Strengthening and promoting an integrated systems approach means that services are more people-centered and are able to respond to health needs, which supports strong progress towards universal health coverage. It is often said that every crisis is also an opportunity. Coping with COVID-19 is indeed presenting some unexpected opportunities. Innovation, such as digital solutions that have been developed to ensure continuity of services, need to be adapted as long-term. As the COVID-19 crisis unfolds, there is need for evaluation, reflection, and learning from all the sectors: health experts, policymakers, scientists, and the population affected. Everyone needs to be involved at all stages of mitigation and responding to the pandemic. While crises routinely and periodically occur, the current COVID-19 crisis is of such scale that it highlights the need for an integrated approach encompassing health, organizational, social, political, financial, and ethical aspects. The information gathered from this experience will be critical to strengthen our response to future crises. Health promotion has much to offer to help people and communities cope with the COVID-19 crisis and its consequences. And the health promotion community can also benefit by learning a lot from this crisis. Thank you very much for your attention, and God bless you.
Thank you, Dr. Esha Mohammed. Can we give her another round of applause? Thank you. Your Excellency, it is now my duty to invite the representative from UNICEF, Dr. Muniza Zaman, to come and make her remarks.
Your Excellency, First Lady Margaret Kenyatta, CAS Ministry of Health, Dr. Mwangangi, Senior Leadership and Management of Kenyatta University, Secretary General of the Red Cross, my sister, Dr. Mohammed, distinguished guests, ladies and gentlemen, all protocols observed, a very good morning to you. It's truly a privilege to be here with all of you today at this very important conference at this very critical time. We have seen the importance of health promotion increase dramatically during the COVID-19 pandemic. It's now just over 2 years since the first COVID-19 case was detected in Kenya, and just over 1 year since the first COVID-19 vaccine dose was administered in this country, an event that I was truly honored to attend. So I went back to actually look at the definition of health promotion. And in the WHO Ottawa Charter for Health, it is the process of enabling people to increase control over and to improve their health. And in this pandemic, this discipline has come sharply into focus. Globally, the United Nations has been supporting health promotion during COVID-19 pandemic. The WHO made risk communication and community engagement, which is a key strategy within health promotion, one of the 10 pillars in the fight against COVID-19, and for very good reason. Before the COVID-19 vaccines became widely available, changing people's behavior and persuading them to follow public health measures was the most powerful way to stop the spread of the virus. And now that we have the COVID-19 vaccines available, health promotion again has a vital role to play in combating myths and misinformation, overcoming vaccine hesitancy, and promoting uptake. Ladies and gentlemen, in Kenya, the United Nations has also been supporting the government on health promotion, including in response to COVID-19. UNICEF, together with our sister agency, WHO, have played a major role in risk communication and community engagement. There were three things that we were focusing on: suppress the transmission, reduce illness, and reduce death, prioritizing the hardest to reach and the most vulnerable groups. And again, health promotion was critical. WHO and UNICEF have been and are supporting the Ministry of Health and the county governments in a variety of ways, including the development of a strategic plan on risk communication and community engagement, media engagement to intercept misinformation, social mobilization, community engagement, rumor tracking and management, and supporting community and frontline health workers. And here, as been said by many speakers before, the key elements for success is really the work with the communities. Across Kenya, local communities play a key role in preventing and combating disease outbreaks, including COVID-19. They are the ones who can explain the barriers and can take action to increase demand for health services. Health promotion nurtures community trust by bringing accurate, scientific information to communities in a culturally appropriate manner and in a language that they can understand. At the same time, we also need the health system to be able to meet people's essential health needs in an accessible manner with quality and equitably. Distinguished guests, recently part of our team was in Kisumu County to see how this community engagement was actually working on the ground. And there they met an inspirational community health volunteer, Daniel Akothi, who was working to persuade people in Kaego informal settlement to get vaccinated against COVID-19. Daniel got the training and was given information on how to counter the prevailing myths. Armed with this knowledge, he had been going door to door through the community, seeking to change minds and behaviors. And here are some words from Daniel. He said, "I talked to households about what they could do. I challenge the myths and misconceptions. For example, in this particular case, boda drivers had been telling people that if you get the COVID-19 vaccine, you cannot get pregnant. I told people that this is not true. The government would not approve a vaccine that can harm you. I wipe out the myths, each one, every day, one day at a time." So on that particular day, Daniel actually persuaded a pregnant market trader to go and get vaccinated and took her to the local health center to get her first vaccination, protecting herself, her family, and her unborn child. So this is the daily work of so many people like Daniel on the ground, and we have to be able to support them much more. Ladies and gentlemen, many are also innovating in the area of health promotion. A couple of examples that we as UNICEF have been working on with the Ministry of Health. We partnered with the Interreligious Council to really see how they could support the vaccination drive. And this resulted in over 600 churches, mosques, and temples open up as vaccination sites. It was an important initiative, and it contributed to the government achieving its target of administering 10 million doses of COVID-19 vaccines by the end of last year. Another innovation was the use of a mobile-based platform which engages youth called UniTalk. We ran a campaign called Give It a Shot, and it was directed at young people. And what we found out is that as a result, several thousands of young people reported that they got vaccinated, some as a direct result of the campaign, and others reported helping a family or community member to get vaccinated. But despite these successes, as Dr. Asha has highlighted, we have seen a slowdown in the uptake of COVID-19 vaccines. The risk perception has gone down. And so with our collective experience and knowledge, let us do a lot more to keep reminding the public that we are not yet out of the woods, and we all have a responsibility to get vaccinated, not just for ourselves, but for our family and communities as well. I'm coming towards the end, and just to say that health promotion is not only about combating COVID-19. Kenya has prioritized universal health coverage as part of the Big Four agenda set by His Excellency the President. The aspiration is that all people in Kenya will be able to access, afford, and use the essential health services they need for their health and well-being. And again, health promotion is an essential enabler of this vision. Hence, it is very encouraging that this conference will take a wide view of health promotion and explore multiple themes, as has been mentioned before. As a UN family, we look forward to the increased prioritization of and investment in health promotion. What it will actually mean is that citizens of this country of all ages will know better how to take care of themselves, seek the right care at the right time, adopt healthier lifestyles, nourish themselves better, exercise, take up behaviors and habits which will lead to overall improved health and hopefully a concomitant reduction of illness. So this is not just good for the individual, it is good for the country, it is good for the economy, and it is good for the development of Kenya. We also believe that health promotion has a wider role to play in supporting the foundation of society and can be extended to supporting positive parenting practices, positive gender roles, and also social cohesion. As I end, let us note that we have only 8 years left till 2030, the year that the world had aspired to reach the Sustainable Development Goals. And COVID-19, yes, has set us back. And collectively, we need to redouble our efforts, innovate, accelerate, and especially find ways to reach those who are being left behind. The United Nations in Kenya and our partners will continue to support the Ministry of Health, both nationally and at county level, to achieve Kenya's vision for the health for her population and also ambitiously pursue the SDGs. We believe collectively through this kind of collaboration and partnership, we can do more and we can do even better. Thank you so much.
Thank you, representative of UNICEF. Your Excellency, it is now my duty once again to invite the Vice Chancellor, Kenyatta University, Professor Paul Wainaina, to come and make his remarks, and in turn invite the chair of the university.
Your Excellency, the First Lady of the Republic of Kenya, Madam Margaret Kenyatta, the Cabinet Secretary, Minister of Health, Honorable Mutahi Kagwe, represented by Dr. Massimo Mwangangi, the Head of Directorate of Preventive and Promoting Health, Dr. Andrew Murwa, represented, Chairman of Kenyatta University Council, Professor Shem Mikota Dola, the Deputy Vice Chancellor, Academic, Kenyatta University, Professor Wacheke Wanjohi, the Acting Deputy Vice Chancellor, Research, Innovation and Outreach, Professor Vincent Onywera, the Dean, School of Public Health and Applied Human Sciences, Professor Margaret Keraka, Deans and Directors and Chairmen of Departments, team leaders in non-governmental organizations, distinguished guests, our staff, our students, and KU family, good afternoon. Good afternoon, Your Excellency, the First Lady of the Republic of Kenya, Margaret Kenyatta. It is our great pleasure and honor to host you during the first international conference on health promotion being held at Kenyatta University. Karibu. Let me begin by expressing my appreciation to the Ministry of Health and other partners, that is USAID, UNICEF, CDC, and WHO, for choosing to partner with Kenyatta University to promote health at a time when the world is recovering from the worst of the COVID-19 pandemic, which plunged the world into a crisis that has touched all sectors of our society. Due to the crisis occasioned by the pandemic, health promotion has become more important than ever before to support the health and well-being of people in our communities. Health promotion activities aimed at improving access to better information and services play a vital role in giving people more control over their health and well-being. Health promotion makes an essential contribution to fighting global pandemics such as COVID-19. In modern societies, new public health approaches are needed that can be adapted to local situations and local needs. As a core function of public health, health promotion supports governments, community, and individuals to cope with and address health challenges. This is accomplished by building health public policies, creating supportive environments, and strengthening community action and personal skills. As such, health promotion may paradoxically be more important in times of crisis than ever before. As a discipline within public health and a field of professional practice, health promotion contributes to addressing pandemic threats at different levels. Our chief guest, while everybody has a key role to play in the prevention and management of pandemics such as COVID-19, health promotion looks at a bigger picture to ensure people's well-being is not negatively affected by promotion messages and information that should actually help us to design better ways of doing this. Kenyatta University has been a part of the COVID-19 mitigation process by enforcing containment measures and vaccinating a large proportion of our population. The weekly webinars in COVID-19 organized by the Directorate of Health Services have been instrumental in creating awareness of COVID-19 preventive measures. In addition, Kenyatta University has focused on sports, games, music, and other recreational activities which are key in promoting wellness. I wish to assure you that Kenyatta University will always be ready to expand into new areas as part of our mandate to serve society as enunciated in our fundamental statements. At the end of the day, our responsibility as an institution is to serve community and our country in general by fostering excellence, training, research, and scholarship. In regard to promotion of health, we are committed to realization of the universal health care as part of the Big Four agenda and Vision 2030. In support of UHC, we released over 2,300 professionals into the health sector every year. As I end, let me once again thank you for sparing your time to participate in the Pioneer Health Promotion First Conference at Kenyatta University, and wish you productive engagement throughout the event that is going to last 3 days. Thank you, and God bless you. Thank you very much. I now take this opportunity to welcome our Chair of Council, Professor Shemigota Dola, to come and address us. Karibu sana.
Thank you. Your Excellency, the First Lady of the Republic of Kenya, Margaret Kenyatta, the Cabinet Secretary, Ministry of Health, represented here by Dr. Mugangi, Head Directorate of Preventive and Promotive Health, Dr. Mulwa, the Vice Chancellor, Kenyatta University, Professor Paul Wainaina, the Deputy Vice Chancellor, Academic, Kenyatta University, Professor Sheke Wanjohi, the Acting Deputy Vice Chancellor, Research, Innovation, and Outreach, Professor Vincent Onywera, the Dean, School of Public Health and Applied Sciences, Professor Margaret Kiraka, Deans, Directors, and Chairpersons present, team leaders of non-governmental organizations, some of them already acknowledged. Ladies and gentlemen, I have to say that I'm really delighted to welcome you here for the opening of the first Kenyatta University Health Promotion Conference. You are welcome. At a time when chronic illnesses are increasing, when inequality persists, when climate change is starting to impact our livelihoods and health, there is a need for a radical change in our mindsets and a recognition of how we promote health. It It is evident that health promotion requires multiple solutions. Consequently, it gives me great pleasure to be a part of this congregation of scholars, of researchers from diverse backgrounds coming together to seek out opportunities and partnerships towards improving health outcomes across various populations. Health is an investment, and its integration in other sectors supports the general well-being of populations. Consequently, and especially with the crisis faced as a result of COVID-19, we have seen health move up to the political agenda in many countries. In developing policies and global agreements precisely because of its relevance to the economy. Also, its relevance fits in political ideology in our country, and it fits very well in the well-being of citizens. But it is in education sector that health must feature prominently for the most obvious gains to be achieved. As a leading institution of higher learning, Kenyatta University prides itself as a hub of quality education, of service to the community, as well as research and innovation. It is with this in mind that the university launched the first Bachelor of Health Promotion program within the country. That takes us back tonight. Thank you. That takes us back 2018. As a university, we have enjoyed a great past, contributing much to the history and legacy of this country. And we look forward to a future where we shall continue to do so in even greater ways. The time is ripe for us to begin reconceptualization of how health promotion will support the generation of health for current and future generations. Therefore, I wish to reiterate my support for the university's zeal and commitment in organizing this landmark conference on health promotion. I would also like to recognize and extend our warm appreciation to the partners who have made it to this conference. We recognize your commitment and your contribution. Many others have not shown, but we recognize them also. For some years now, promotion of health has been defined to include multidisciplinary concerns, including social, economic, environmental processes, implying assisting communities, empowering communities to be significantly involved in their own health and in promoting their wellness, which can also be said to be fighting against disease. On behalf of the entire Kenyatta University community and our partners, I once again welcome you. The attendance is very inspiring. So I feel obliged to welcome everybody to this function and look forward to very fruitful deliberations. Thank you. At this point, I was going to invite the Cabinet Secretary, but it was held up, but very, very ably represented here by Dr. Mwangangi, who, because of those briefings daily, we all know. Doctor, you're welcome.
Thank you to the Chair of the Council for that introduction. Your Excellency, the First Lady, Mama Margaret Kenyatta, development partners present today, senior leadership and management staff from the university, representation from the Council of Governors, ladies and gentlemen, may I start today by thanking you, Your Excellency, for honoring our invitation to join us today as we hold this inaugural conference on health promotion. Your presence here today is a testimony of your commitment to the health sector in general and to health promotion in particular. We appreciate the various events and your participation and stewardship in different initiatives within the health sector, not forgetting, of course, the initiative Beyond Zero that has helped build on to the Linda Mama presidential project on ensuring that skilled deliveries do take place across the country. I'm certain you will find that health promotion is a worthy complement to your efforts in your health initiatives. The ministry indeed is committed to ensuring that all Kenyans receive quality health services, but also that diseases are prevented through empowering people to take charge of their health care. I think we've learned through the COVID-19 pandemic the role of individual responsibility when it comes to our health care. And so really, Your Excellency, today we are absolutely delighted to have you here. If I could scorecard you as you come to the end of your tenure, I would say each and every initiative that you've touched on is indeed touching on health promotion. From working with mothers, from working with children, from working on elements of nutrition, even the Beyond Zero Marathon that I have participated in and come last was a good initiative when it comes to health promotion. And so, Your Excellency, I'm absolutely delighted, and it is my distinct pleasure and honor to now invite you to come and make your remarks at this inaugural conference on health promotion. Karibu, Your Excellency.
Seated. Distinguished guests, ladies and gentlemen, it gives me great pleasure to join you today to launch the International Conference on Health Promotion themed Promoting Health During and Beyond COVID-19. I would like to thank Kenyatta University for hosting this event and also the very warm welcome and the wonderful entertainment. Thank you. I acknowledge the partners and conference participants for coming together for this event to share experiences of health promotion during and beyond the COVID-19 pandemic. The pandemic disrupted lives, livelihoods, communities, and economies. We also know that it put health workers under extreme pressure. The conference objectives urge us to create synergies, build partnerships, and identify future actions that may contribute to policies. This conference, therefore, gives us an opportunity to reflect on some of the invaluable lessons we have learned as a country and as the world from the COVID-19 pandemic. It will also contribute to identifying sustainable practices that will build on our collective efforts of improving the well-being of our communities, especially vulnerable populations who have been impacted most. Today, we see encouraging signs of declining cases of COVID-19 globally, but we cannot forget the fragilities of our health system and the need to increase our resilience so that we can protect ourselves from potential disruptions that are still a reality. Pandemics such as COVID-19 can impede our efforts towards building a secure health system that brings our country closer to achieving universal health coverage. Central to this effort is to ensure that our most vulnerable communities, especially women and children, are protected, because even before the pandemic, inequalities of access have existed. These inequalities have been a key concern that have heightened the government's investment towards increasing health access for its populations. This is why it is critical that we share our lessons and learnings from this pandemic and align our recovery measures with long-term sustainable strategies. Most notable has been the important contribution of health promotion in tackling the challenge of the COVID-19 threat and its societal impact. Many of the containment measures that we adopted and relied upon to prevent the public and healthcare workers from getting infected and our health systems from being overwhelmed imply a change in behavior. Hand washing, wearing face masks, and social distancing are all forms of this change. In addition, health authorities have tried to enhance protective behavior amongst the public by issuing warnings and recommendations about this new virus. The victory of these measures provides impetus to turn the tools of health promotion for any future health crisis. Whereas we've made remarkable successes in the control of the spread of COVID-19, we're yet to achieve our vaccination target. The efficacy of the COVID-19 has determined that the vaccines increase our protection from the virus. We are not safe unless we are all vaccinated. Going forward, we must ensure that our health promotion efforts are inclusive. We must ensure that they enable our populations to have access to affordable health care, as well as have all the information that will help them determine their health outcomes. Health literacy efforts and multi-sectorial action that contribute to increase healthy behaviors are key lessons that are essential in safeguarding the public's health. Our health and well-being is indeed the prevailing concern that takes precedence over all other issues. The multiple dynamics we face in ensuring that we build a resilient and stronger health system remains a national priority. Our collective diverse knowledge provides significant opportunities that we can leverage to develop meaningful solutions to global health crises. Through clear communication based on health literacy, as well as through collaboration across countries, disciplines, health, and education systems. It's for this reason that I once again express my delight that this Health Promotion Conference is underlining the importance of promoting health during and beyond COVID-19. You are all here, you here all have opportunity to contribute towards a better understanding of the world we currently live in and development of best practices towards promoting the health agenda in the coming future. It's therefore now my honor to declare this conference officially open. Thank you very much for your attention, and I wish you fruitful deliberations. Asante sana.
Can we give another round of applause to Her Excellency the First Lady? Asante sana kwa mawaidha mazuri, and I request that we may take our seats. Thank you. I'm being advised by my co-MC, thank you, that we are going to have a photo session out there that will be immediately after the vote of thanks and after the national anthem, before immediately when the VIP leaves, our chief guest leaves, we are going to have a photo session right at the entrance, and the following should be prepared for the photos. The first one will be Her Excellency, the First Lady with the VIPs with her on the main dais. And then the second one will be with the council members, led by the chair of the council of the university. The third one will be with the KU, Kenyatta University Management Team, that is the deans and the team leaders, the chairman and all the chairpersons, and also the directors. The other one will be with our partners and sponsors alike. And then the last and not least will be with the Public Health Committee, which is present now. At this moment, Your Excellency, allow me to invite Professor Vincent Onywera, the Acting Deputy Vice Chancellor, Research, Innovation, and Outreach, to come and move a vote of thanks on behalf of the institution.
Thank you, Your Excellency, the First Lady of the Republic of Kenya, Mama Margaret Kenyatta, the Cabinet Secretary, Ministry of Health, represented by the Chief Administrative Secretary, Dr. Mercy Mwangangi, the Chairman of Kenyatta University Council, Professor Shem Migota Dhola, our Vice Chancellor, Professor Paul Wainaina, the UNICEF Country Representative, Kenya Office, Dr. Zaman, the Secretary General of the Red Cross, Dr. Asha Mohammed, the members of the University Management and the Senate, our development partners, the county commissioners, the keynote speakers, our dear students, conference delegates, distinguished ladies and gentlemen, good morning. Hamjambo, salam alaikum. Your Excellency, mine is a very humble task to move a vote of thanks, and allow me, Your Excellency, to start by appreciating you, by thanking you so much for finding time out of your extremely busy schedule to come and preside over the opening ceremony of the inaugural International Conference on Health Promotion and Wellness. We don't take it for granted, Your Excellency. Secondly, allow me, Your Excellency, to thank you for your dedication and selflessness in ensuring health promotion, happiness index, and well-being through the very many dedicated and signature initiatives which you continue to spearhead and lead, and especially the Beyond Zero Marathon, which I have also participated in, Your Excellency. All these initiatives, Your Excellency, continue to touch lives. They continue to transform lives not only in our country or in our region, but internationally. For your selflessness and dedication, we want to wish you, as Kenyatta University, continued God's blessings, wisdom, good health, and long life. I wish to request your kind permission, Your Excellency, that all the members of the audience to be upstanding so that we can appreciate Her Excellency with a standing ovation for her dedication and selflessness to humanity. Let us put our hands together, please. Thank you, thank you. Kindly take your seats. Let me thank the government, the Ministry of Health, for the wonderful work that you continue to do, especially in the face of the COVID-19. CS Mwangangi, you kept reminding us not to drop the ball. And we as Kenyatta University are holding on the ball so that we can continue to witness healthy, active living devoid of disease. We thank the university leadership, the Chairman of Council and the Vice Chancellor for providing an enabling environment that is supportive and conducive of the core mandate of the university, teaching, learning, science, research, and service community. We thank the development partners and all of us. Kindly let us put our hands together to all of us for this wonderful conference. With those few remarks, allow me to invite Dr. Esther Mbithi to come upstage so that in the warm Kenyatta University culture, Esther come and assist the Vice Chancellor and the Chair of Council to present a humble gift to Her Excellency, the First Lady. Kindly, Vice Chancellor, Chair of Council, and Your Excellency, kindly.
Also, Madam Cass, please.
Thank you very much, Professor Vincent Onyora. It is our culture at Kenyatta University to say thank you in word and in deed. So we have invited our Vice Chancellor to step forward and present a token of appreciation to the chief guest. Your Excellency, the First Lady of the Republic of Kenya, we truly appreciate your presence here today. It is for us an invaluable gift. And as we say thank you, we invite you to please accept our token of appreciation.
Can we give a round of applause as Her Excellency, the First Lady, receives the gift from Kenyatta University? Thank you, we appreciate.
Ladies and gentlemen, it looks perfect for the First Lady of the Republic of Kenya. It is a mother giving sustenance to a child. Thank you very much once again. It is also an open invitation from us. Please visit Kenyatta University again and again. Thank you.
Tupige makofi tafadhali. Asante sana. Thank you. Thank you. With that, I request that we remain on stage. Your Excellency, we remain on stage. As we come to the close of this program, may I request that we all be upstanding for the closing national anthem. With that, we have come to the close of our meeting, and at this moment, Her Excellency will leave at our own pleasure. Those ones who are proceeding to the photo session, kindly we meet out there.
Dear audience, kindly let us not interrupt the photo session of Excellency. We request you to keep calm. Let's not go to the photo session, please. Only those involved in the photo session are moving towards it. The rest of us, kindly do not interrupt the session. Thank you.